Hi, I'm Brittany with Sam's Insurance Services. I just wanted to take a quick minute to go over your Anoc with you. Anoc means Annual Notice of Change. This is the document they're going to send you from your insurance carrier that goes over all of the changes for your plan for next year. It's super important to review this. Please make sure and follow along with me.
Good afternoon. I wanted to go over the annual notice of changes for the United Healthcare's PPO plan. If you have your booklet with you that has come in the mail, please grab it and go through it with me so you can kind of follow along. I will have you change and go to the page 6 is where it kind of starts. The monthly plan premium is not changing this year to next year. It's still a zero premium plan. The max out of pocket is going from $3,600 this year up to $4,900. The max out of pocket for out of network services is also increasing from $6,200 to $9,200. Primary care is still going to be a zero copay in network this year and next year, $25 out of network for this year and next year. I'm going to focus more on the in-network copays now, but feel free to read the ones below. The specialist visits are going to be from a $25 copay over to a $40 copay. Inpatient hospitals taking a jump. It's going to go from $340 a day for the first 5 days this year to $455 a day for the first 6 days next year. The prescription drug coverage has got a couple changes. Their tiers 3, 4, and 5 are going to have a deductible, and that deductible this year is $420. It is going to $520 for next year. Then we're going to scroll on down, it looks like, to the dental. And that should be coming up here pretty quickly. This stuff kind of goes over everything that we've kind of talked about a little bit more in depth. So the monthly premium, the max out of pockets, and then I believe your copays are also going to be pulled up. So it'll be just a little bit farther and we'll get into the bulk of some of the new changes. So acupuncture's got some changes saying that there's a zero copay for this year and next year. Some of them, if they have the specialist, again, was that $25 this year, $40 next year. Chiropractor is going to keep coming, so it'll be a little bit farther. $25 copay for acupuncture for low back is in both to this year and next year. Out of network is going to be a little bit increased from $50 to $65. Foot care is going to go from a $25 copay to a $40 copay. Chiropractic services, otherwise than the acupuncture, is $20. It's going down to a $15 copay, which is great. The out of network is increasing from $50 to a $65. Chronic care management's coming next. They do have some coverage in there. Definitely check out your evidence of coverage to make sure that you understand that part. Dental services, here they are zero copay for covered preventative and diagnostic services for last year and this year. Going to still continue to have that 50% coinsurance for all covered comprehensive dental services. That amount that they are paying total per year is decreasing from $2,000 a year to $1,000 a year. Just make sure that you are aware of that. Diabetic self-management training and supplies and services is also still covered. They do still have certain brands they want you to use. Last year it was AccuCheck and One Touch with a zero copay. This year it's going to be the AccuCheck and the Contour, I believe. Emergency care is $140 this year. It's going to go down to $130 next year. Hearing services are still going to be covered. Zero copay as long as you stay in your network for routine coverage. Medicare covered hearing and balance exams are going to go from a $50 copay to a $65 copay. And the hearing services are still going to have a coinsurance for your hearing aids, anywhere from $199 to $1,249 for next year. Inpatient hospital coverage, again, was that $340 for days 1 through 5 this year, but it's going to $455 for 1 through 6 next year. Inpatient mental health care is very similar to your hospital stay, $340 for 1 through 5 this year, $455 for 1 through 5 next year. Diagnostic tests, therapeutic services, and supplies and x-rays has a $25 copay this year, $30 for next, so a little bit of increase on that one. Outpatient diagnostic testing is a $250 copay this year, unless it's a mammogram, and then it goes to a $260 next year. Outpatient rehab services are a $25 copay this year. It's going to be $40 next year. And then occupational therapy is a $50 copay if you're out of network, $65 if you're out of network for next year. The rehab services, physical therapy and speech therapy, were all a $25 copay this year. That's going to go to a $40 copay next year. The outpatient surgery ambulatory surgical center is a $290 copay this year. It is going to a $405 copay next year, and that's for anything except for a diagnostic colonoscopy. That one is still a zero copay on both this year and next year. Outpatient surgery at a hospital or an outpatient facility is a $340 copay this year. It's going to go to $455 next year unless it's a diagnostic colonoscopy. Again, it's a zero copay. And then the outpatient surgery is a $340 copay this year. It's going to a $455 copay next year. Just keep in mind, all these copays add up, then they're going to hit your max out of pocket. Once your max out of pocket is satisfied, you're done paying copays for the year. Then you have the physical practitioner services is a $50 copay this year. Out of network, it's going to a $65 copay next year. And then we have your specialist visits, which is a $25 copay this year, and it's going to a $40 copay next year. Back to that podiatry, still $25 this year, $40 next year. And then we're going to go down just a little bit farther, and we will have $50 copay for your Medicare covered podiatry services, $65 for next year. Skilled nursing facility is a $0 copay for days 1 through 20, but then from 21 to 100, you had $203 copay this year. It's $218 next year. That is the only thing that does not go towards your max out of pocket, guys. Just a heads up. That is what they call that kind of middle area between short-term care and long-term care. Medicare does not pay for long-term care, so they give you 100 days in your whole lifetime for you to be able to use that short-term care. So that is why it does not go towards your max out of pocket. Everything else does. Skilled nursing facility is a $225 copay for this year for days 1 through 100, $250 for days 1 through 100 next year. Urgently needed services is a $65 copay this year. It's dropping to $50 next year. And vision care is a $50 copay this year, going to $65 next year. They have several different screenings that they'll let you do. They do have copays associated with all of them, unless it's just an additional routine eye exam, and then that would be a $0 copay. They do have vision care eyewear that is included. It is a $0 copayment for standard lenses. You'll have a $40 to $153 expense for other covered lenses. You get to get one pair of glasses every 2 years. So that is just across the board. They did have a $300 towards frames on last year, but it is dropping to $150 this year. And that is most of the things I've seen that are the changes. So if you have any questions, please don't hesitate to reach out to me, and I'll talk to you soon. Thanks.
Thanks for taking time to go over this with me. Please give Sam's Insurance Services a call at 620-262-6885. Thanks and have a great day.